No problem. Come in here for a fit check.
Oh my god, he's hitting me with it.
Hey beautiful people, welcome back. This is Voyage of Emina and you are with me in Baltimore as an MPH student at Johns Hopkins Bloomberg School of Public Health. These videos were shot back in 2024 summer, and I only got time now to edit all of this into a video. We just made in time for the first session. We had a little bit of scare with the transportation, but it was all figured out. Big thanks to Dr. Murray, our chair, and Rebecca, our in charge, and Jill, as well as our MPH program coordinator. We're so grateful to them who actually eased our entire settling down into the routine of the campus life. That was a daily grind area which you saw earlier. It's an area where faculty and students just come in to grab a bite. So each day for us was power packed. We had a lecture in the morning for about 40 minutes, which was 30 minutes of lecture, maybe 20 minutes of questions and answer, followed by a break. And then all of us broke into groups. Each of these groups were led by a TA, and then we worked on a real life project which we had to present at the end, for which we were graded for. And the course that we took was in problem solving, so it was very, very interesting to work with different people from different backgrounds, from different cultures, and overall was a very enriching experience. So since we were day one, Rebecca, our in charge, took us around campus, got us settled in. So this was a surreal moment standing in front of this building that we had just seen in pictures, and we've been part of it, but then it felt surreal being there in person. And we got introduced to Miss Karen, who is the historian of the school, which is so cool. I never knew universities had a historian who actually talks about and writes about and researches about the history and the contribution of this particular institution. So it was really great to hang around with Miss Karen, and she took us on a historical tour and explained to us the significance of Johns Hopkins University and the School of Public Health to the field of public health. So I'm just gonna leave a long video of her just talking about the history. For those of you who don't want to listen to it, can skip. I'm just going to mention the time frame, so you can skip to the rest of the video, but the others who are interested can stay back and listen to it.
A kind of modern science-based medical school in China. Mm-hmm. And so they were trying to decide where should it go, but I was mentioning John Black Grant. John Black Grant is a really fascinating person because he grew up in China. He was the son of missionaries. He spoke fluent Chinese, and he was part of this as well. So the medical schools and public health schools that our faculty and alumni helped to found, they carried the ideas of the importance of prevention, preventive medicine, and public health ideas to other countries. So this, it was the Peking Union Medical College and also the All India Institute of Hygiene and Tropical Medicine, it was originally called, and then now Medical Sciences. Those two institutions, so that was founded about 1930, and then this one that was founded in 1921, those were, not like copies by any means, but modeled in some ways on the School of Public Health, and they were funded by the same group, the Rockefeller Foundation. So in the early 20th century, the Rockefeller Foundation was like the Gates Foundation, the NIH, all of the research, education, and it was all, a private foundation. The governments weren't, there was some, international work among the governments, but the Rockefeller Foundation really started both the philanthropy and the scientific methods that are now used across all of those fields. them, that we really care about their education and well-being. And teaching hospitals to advance public health methods and perspectives in hospitals. And in the 1900s, people were going, what? Why would you do that? Something more serious?
Welcome to Johns Hopkins Boutique Merchandise. These are very sustainable, very inexpensive sweatshirts that you can wear at home and nowhere else. So we have olive green, black one, light blue. Yeah, that's it.
No.
Oh no, it's okay. This is for Chitra's blog. Good evening, good afternoon, Shabak Khair. I think I'll become a blogger by the end of this. आज हम कर रहे हैं बाल्टीमोर की बस की सवारी। ये है एसी बस जो फ्री में चलती है सभी लोगों के लिए। जरूर आइए।
ഇപ്പൊ സമയം എന്താണെന്ന് നിങ്ങൾക്ക് പറയാൻ പറ്റും? Can you guys guess what the time is right now? It's 7 p.m. electricity, it was fine. So then it cleared up.
We're staying in an Airbnb, it's like the basement.
Didn't make sense, like finding a house.
Yeah, exactly. No, it didn't. Because Marie told us, she said, well, you know, there's two sides of the building, there's east and west. And that was all.
Wow. There's like so many people.
How will we know what exactly was the Are you prepared in case of an emergency? It's okay.
Yeah. Like the entire building.
Can we get on the sidewalk, friends?
Yeah. 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 What do you have to say?
It's been an exciting day.
Yeah. Oh, wait, I'll just say that. And a hot dog. Gyno and a hot dog.
Hello, good afternoon. Today again we are on another adventure. Northeast market done, goodies secured and now we're waiting for our bus. Utilizing the public transportation to its maximum.
Yeah, look at how windy it is. And like the main character.
Okay, see you next time.
Yeah, you can. It's in editing mode.
superintendents because they're like a larger governing body that's national and they have this conference. And I think one of the things I do want to mention is that we believe that while we have a national audience, it's within like the kind of like.
Agree.
Yes.
Okay.
Yes. Oh no, here we get to the bad.
No, come
Please,
on.
please rip it out.
So all we have is implementation, communication strategies, and that's it.
We're almost there.
And then we have to
Yay.
and then we have to make some hard decisions. Okay. But we have 2 more seconds left. That's it.
Okay.
And
Let's
if
go.
we yes.
Everybody.
Go ahead. You read us. Unless you need a break.
No.
Okay.
The U.S.
I'm sorry, this is my cousin's name. That's why.
Where are you going?
So Uzma Group has
You gave your
3
cousin a logo. You should see it later.
in presenting at the AASA conference. First, to create awareness among school superintendents on the alarming rates of
Oh yeah, the George Washington Monument in Baltimore.
You're like, what's this like bland rice pie? thing that they sell at Whole Foods that they say is
No,
Indian.
she's-
No flavor.
She's gonna go home and be like, tasteless.
So that is an air ambulance to transport patients. That is a children's hospital.
You warn somebody.
The moment he was up there for the Q&A, that's like.
Yes, finally.
Actually, I'll have heard him.
Do you have any parting words?
It was great meeting you.
Yeah,
I love taking this class with you. I wish you the
Bye.
best. Let me know if you're in Minnesota.
Yes, and let me know if you're in
So good to meet you.
I mean, like, really, like, especially like we could like connect a little more with like some of the things that we know, like she was able to relate. So yeah, like we like yeah, we love Pisces. Yeah. Especially like her, like I'm from the south, like we do a lot of